Welcome to this edition of Vital Signs. I'm Dr. Randy Tobler along with Kelly Webb, and today we have a great show planned for you at the second segment. We're going to be talking with Dr. Michael Jones from Illinois Eye Surgeons. You've heard me talk about him, but when you hear about the things that he has done and they are doing and they are bringing in the future to eye care in the metro area, you will be astounded. And Kelly, I don't know about you, but who doesn't at some point in their life need either a pair of glasses or a cataract operation or, something going on? It's just, of all the senses, I think the eyes have it. No pun intended. But certainly it's something that I know I've struggled with all my life. I remember that first trip to the optometrist when I was a young tyke in school and couldn't see the board and sitting right in front of it, and Mom and Dad finally, Mom grabbing me by my ear said, "Come on, you got to go get glasses." And it was the start of just a lot of ugliness because, it's not fun to wear glasses when you're in first grade. It's just not fun, and everyone calls you four eyes. And then when you're in little league, you get caught. You get hit. I remember it's funny. We talk about the story over and over. Was standing up at bat at Corey League, got hit in the temple of the glasses and knocked it into my eyebrow. Had a bleeder there, and it was that's why I was never a sports guy. I pivoted rapidly to biology and chess club after that, and yes, there was the Russian club at school, but and of course there are more serious problems. But Illinois Eye Surgeons has many folks taking great care of people, and we're going to talk to Michael Jones. And learn about the practice as a whole and some special things that they're doing. How do the eyes have it in your family? Do the little ones, Roman, Alexander, have they have any problem with their eyes or no? They're pretty good.
Actually, Romans are fine, and we thought he was going to need glasses, and we went in for our kindergarten checkup. She needed them. And it was one of those things where the doctor, we're fortunate, and we're hoping this is the case, that she will outgrow it. And if she wears the glasses, it's the shape of the eye. And if she wears the glasses for a year or two, she should outgrow it and it will correct the vision. So we're keeping our fingers crossed.
Okay, good. Well, we'll talk to Dr. Jones in a little bit, and of course invite phone calls as well as always. And we haven't done a show on ophthalmology and on optometrics and good eye care in quite a while. So I'm looking forward to this because there's a lot of exciting things too about nutrition. And I know that's one thing we emphasize on this program is you cannot avert or treat or cure every disease. In fact, most diseases by lifestyle issues, by eating the paleo diet or by exercising 5 times a week or by this or that habit. But we want to talk with Dr. Jones about things that can be done, both in terms of screening and nutrition and fitness and so forth, that may affect eye health in terms of serious eye health, retinal health and others. Cataract formation, I know, is related to some of our lifestyle choices as well. And we'll talk to him about that because that's often very, very important. And as we know, avoiding the issue is often easier and more pleasant than dealing with it. Now, Kelly, I know when you are dancing to the oldies or swimming to the oldies or whatever you do to exercise, you always are thinking about the formula. We've talked about the formula before, the formula for your heart rate, 220 minus your age, and then you shoot for 80% of that number. So if you're 40 years old, let's say you're 20 years old, 220 minus 20 is 200, and, 80% of that is 160. So that would be sort of your, the upper heart rate limit. And, and then there's different formulas that have been used over the years. Well, researchers now, Kel, are saying that in fact, that's okay if you're a guy, but these are based on studies over the past 40 years that were guy-only studies. And as the one researcher says from Ohio State, women are not small men. Women have a different exercise capacity, and they need to use a gender-specific formula, and so they have developed one. Which one do you use, or do you use one?
I don't use one. I'm sorry.
Yeah.
Because
you just work till you sweat and can't breathe anymore.
Well, I wouldn't go that far. Now, one of the things that I've heard is you have to be very careful, and depending on, and that's kind of how I judge, is whether you can talk while you're doing your workout, whether it be walking, whether it be aerobics, whether it be, Let's Dance 3 on Wii or whatever it is. If you can still carry on a conversation, you're doing okay. It means that you're at this level, or it means that you're at this level. And I'm a little more careful with it, I guess, since my heart rate tends to be extremely fast. I have that tachycardia. So I'm a little more careful with it.
Okay, sure, yeah.
Yeah, it would be kind of hard for me to judge.
Yeah. Well, I think, and certainly I think the older you get, the more whatever formula you use has to be taken with a grain of salt, because there may be other conditions. I mean, if you have underlying risk factors for heart disease or strokes or vascular problems, if you've had long-standing blood pressure or diabetes problems or obesity or on and on and on, you have to be careful, because in fact you don't want to just go out there and start subtracting your age from 220 and then get up to that heart rate and keep it there for half an hour. You need to work up to these things. Talk with your doctor. Make sure you get a checkup. Make sure, in some cases, it may be prudent to get a stress test, to make sure that you're fit for that and you're not going to do more harm than good. But, I mean, for young folks and folks that have been in relatively decent shape, I think the formula for men, 220 minus your age.